Good evening, everyone, and welcome to the New Teeth Now webinar. My name is Bianca, and I'm here tonight with Dr. Richards.
Hello.
And tonight we are going to be talking of all things full mouth dental implants and the New Teeth Now process. So we are very glad you joined us tonight. Thank you for taking the time to be here, and we want to answer your questions. So through YouTube, there's a comment section. You can type in your questions right there, and we can look at those and answer those tonight. So
Sure.
we're excited to do that. And we're just gonna go ahead and jump right into things. Let me see, let's get to know Dr. Richards a little bit. So he is a board certified oral and maxillofacial surgeon since 1982. So he has over 40 years of dental implant experience and is an innovator of the New Teeth Now process. And I always like to have the viewers know a little bit about how that innovation, like what you've seen progress over the last few decades.
Seen a lot.
Yeah.
Since 82-ish. We were using various, what now would be considered archaic types of implants back in the early 80s, late 70s. And the Brandemark series of precision implants came over from Germany or somewhere around 84, maybe 85. And they were approved for the lower jaw, so we started doing that, and we started immediate loading back in those days. We played with teeth in a day, teeth in 3 days, teeth in a week. So what we're doing today really is an evolution of procedures that were started in the early 80s. So it's been a lot of changes. And if you've watched any of these webinars, you're going to see tonight that we have some changes in our webinar. We sort of have gone digital, 80% digital. And we have some digital information tonight in this webinar, which those of you who are techie, which lots of folks now are techie, I think you'll find this very interesting. And there will be more to come with digital as we move totally digital over the next year.
Yes, so it's really exciting, and we'll touch on that. And really, just a few slides actually, we'll get into the technology we're offering with impressions and the implants in the teeth. So to show folks what we're even talking about in general, so what is a fixed hybrid? What does that look like?
Well, and I'm looking down at the same slide that you are at home. And fixed, of course, means it's fixed. It doesn't come in and out. It's retained by screws, not glue. Upper, of course, that refers to the upper jaw. And hybrid is a term which, to me, means that it's part crown and bridge work and part denture. So, and also that the implants, the position of the implants is totally independent of the position of the teeth. I think we've talked about that almost every webinar. Like if you were going to place crown and bridge work on implants, the implants would have to be positioned precisely so that the tooth could go onto the implant and it would look like a natural tooth. Whereas with the hybrid that we were just looking at on that screen, even though in this photograph those two front teeth implants are placed precision, they don't have to be. So there's a disconnect between the implants and the teeth, and that is really seen in people who have been wearing dentures for like 50 years. And they come in and they have dentures, and the dentures are very thick because the dentures are filling out their face where there once was bone. And so the implants go where there is bone,
right,
and the teeth go where the teeth need to be in their mouth so that they look appropriate, and that's a big discrepancy.
Definitely.
So I hope that explains to the viewers
the
hybrid concept.
That's what we mean when we say hybrid. And this is just an image of the lower hybrid, so similar. Can you explain about like how many implants you place per jaw typically?
I think in our business in general, with all of the doctors in our business, it's typically about 6 implants in the upper and anywhere from 4 to 7 in the lower. And that's all dependent on the available bone.
Right.
Everybody's different.
Perfect. And we did have a quick question come in, so let's go ahead and answer that. So this person says, I'm a 64-year-old male with untreated hypothyroidism. I don't want to take Synthroid because I don't have any side effects. Will untreated hypothyroidism make me ineligible for the both jaws procedure?
I don't think that would make you ineligible. No.
Perfect.
We could talk to your physician a little bit more about that, but I don't think that would be a total disqualifier. No.
Good question. Keep them coming, guys. All right, so we're going to talk about what the day of surgery looks like. So this is a general overview. So if you came in for surgery, you'd come in about 7:30 in the morning and are put under a deep sleep with a general anesthesia for a pain-free procedure. First, Dr. Richards will extract any teeth if you have them remaining, and then he'll place all of the implants needed, whether it's traditional or zygomatic, which we will cover. And while the patient is still asleep, he will take digital impressions for the lab to then customize the teeth, which we will watch a short clip next. And then the patient will wake up in a private recovery room while our in-house lab takes that digital impression and makes those teeth for the same day delivery. And then in the late afternoon, the teeth are placed in the patient's mouth and adjusted, and they are good to go home. So that is a brief overview. Do you want to touch on anything before we talk about technology?
I think the slides pretty much are self-explanatory, and what you said is accurate.
All right, cool. So we'll kind of just talk about what new devices we're using during the surgery to make same-day teeth easier.
Right. Yeah. I think we're going to run a video, and I can talk while the video is running, but this device is called a micron mapper, and basically it takes an impression. It takes a digital impression. It can take a digital impression of 6 implants in under 10 seconds. And the digital impression which it takes is far superior in accuracy from the old traditional type of impression. And this is very techy digital. This shows just a digital scanner scanning some teeth. People have dentures that we have to scan. This is a picture of teeth being scanned on a different type of a scanner. And we have some pictures in here of printers, 3D printers. We're doing now for the teeth that a person receives on the day of the procedure. They are all printed. They're printed out of a material called onyx, which is a liquid ceramic material. And this is a printer printing a set of teeth with all the sprues, and that's all cut back and painted so that on the day of the procedure we have this printed set of teeth that is screw retained. That was real quick, going through a lot of stuff, but all of the micron mapper impressions, all the way through to emailing those digital impressions to our designer, Roxy, who's in a separate building, having her design the teeth in an ExoCAD software, then to email that program back to our main office for Terry to do the 3D printing up in the lab.
Yes.
So, last year we weren't doing this. Mm-hmm. This started in October. So it's come a long way, baby, and it's gonna go further.
And how is this process, how does that benefit the patient versus like the old way of doing things?
Well, it's so much more accurate. We would have ill-fitting. What you have to understand is, we don't have an example of a hybrid here, but you have, could you go back in that video to that final printed set of teeth? You have a set of teeth, that's good, or back up one and show that when it's still kind of raw. But those interfaces, and you can see in that set of teeth there are 6 interfaces. And all 6 of those interfaces have to fit onto the implant abutments precisely at the same time, or the screws won't hold it in passively. In other words, when we screw those teeth onto the implant abutments, if it's not lined up perfect, the screws will not be passive. And if the screws aren't passive, that introduces bad forces into the system. And so with traditional impressions, we would find ourselves having to cut the impression and reset it and things like that. Whereas with digital impressions, these things are dead accurate every time.
That sounds like a great benefit.
It is. So that is, I think, the main benefit is it's quick and it's accurate.
Right, perfect. We had another question come in. For the zygomatic procedure, would you recommend someone having their teeth removed prior to coming to your clinic, or is it recommended to have all the work done in one setting by one dentist? And this is about the most cost-effective procedure as well.
I would recommend doing it all at the same time with one, with the qualifier being that if there is an infected tooth sitting smack dab in the middle of where that zygomatic implant is going, I will try to get that tooth out 2 or 3 weeks in advance. Not all of the teeth, but that tooth that's going to be sitting right where the zygoma implant would be sitting. But definitely, you don't want to go through it twice. I mean, having the teeth out and having the implants placed is just the way we do things. It works. We do that for everyone. We do not take out teeth and put people in dentures for 6 months and then come back and place implants. We just don't do that. It's not the nature of our business. Never have done that. And we just take all the teeth out, even if they are infected. And, you know, it all works. I mean, it works very well. And I can tell you that with 40 years of experience, it works.
Yeah, so no need to go through it twice. And it's all included in our fees. So for our facility, at least, it doesn't matter if you need extractions or not. Like, everything is included, so you might as well just
in the end, when she talks about the fees are all inclusive for the job. So if I was going to do a 4 zygomas on a person without teeth, or if I'm going to place 4 zygomas on a person with teeth, it's all the same fee. So actually, you might make out better doing it all at the same time with us.
Good question. And so we are all in one day and also all in one office. So New Teeth now has our surgeons, our dental lab, and our restorative doctors in one operation working together. How does that also best serve the patient?
Well, I mean, this is kind of self-explanatory from looking at this slide. There's no getting in your car and going to another office. If there's a question about the teeth part, the restorative dentist is right there. If the restorative dentist sees one of the patients who's had a procedure and they have a question about the surgery, we are right there with them. The lab is right there with all of us. And so everything is done all in one sitting, all in one place. So this business model is probably the biggest move that we made for the benefit of our clients, I think. Yeah.
Just better communication, and just all around easier when everyone can communicate and work as a team together. And we do have 3 locations, so 2 in Florida and 1 in California. So we have Lakeland, which is centrally located in the Villages, is just a couple hours north of us. And then our office in San Diego, California. So from coast to coast, you can come visit us. And we have a team of wonderful surgeons as well. Dr. Richards, Dr. Kirkpatrick, and Dr. Vorwald are here in Lakeland. Dr. Nunez is in the Villages, and Dr. Shrafi is in San Diego. And before we show our video, we do have a few more questions, so let's go ahead and answer those. I haven't had upper or lower molars for over 45 years, so would it be realistic to expect that I could get used to chewing and using molars?
You would, because we see that all the time. People who come in with a train wreck in their mouth, they're scared to death for whatever reason. Usually it's fear and anxiety and just not wanting to do anything, and something happens either infection-wise or their spouse pushes them into it. They come in. So we see people with compromised, let's say dentition, they have compromised teeth. We see people that have 2 teeth and they don't even touch, or they have 4 total teeth that don't touch, or they have nothing but front teeth and they're wearing removable partial dentures that stay in their purse or their drawer in the bathroom. So it's common to see that situation, and everyone seems to accommodate once they're all squared away. Now, I'm not going to say that may happen in one day, but you will accommodate to it.
And we don't have an office in Ohio, but we're more than welcome to fly to Florida or California, and we can help coordinate that. And then do the zygomatic implants take longer to heal than traditional implants?
No. They're titanium. They're the same material as traditional implants. They're actually more stable, more solid. They're the strongest implant we place. So we let everything heal 5 or 6 months. We can talk about healing time when we talk about the management of the teeth.
Yes. Yes, we can talk
at
a
some
little bit more
point.
about that.
Yeah.
And last question before the video, how common is it to do the procedure on people with active teeth and mouth infections, like periodontal disease?
Common, like every day.
Yes.
If they have teeth, if people have teeth, they're not good teeth that were taken out, typically. So folks come to see us because they have bad teeth. And I would say that probably 75 to 80% of the folks that we work on have bad teeth that are periodontally compromised. And that's why they're having their teeth out. Not that the teeth are bad, but they have periodontal disease. So that is a greater majority of what we do.
Perfect. And we're going to hear from Kimberly. That's one of our patients, and her story and how it's transformed since New Teeth Now.
Before New Teeth Now, my teeth were in terrible shape. I had missing teeth, I had dark teeth, and I just didn't smile. I wouldn't wear lipstick because I didn't want to draw attention to my mouth or stuff like that. I was very self-conscious of it. I went to 2 places to look for the dental implants. The first place I went, I felt like I was more of like a chain place, like more of a fast food restaurant than New Teeth Now. I felt like I was going into a steakhouse. It was explained much more at New Teeth Now than it was at the other place. That's what put me at ease. One thing that put me at ease the most was knowing that I was going to be put to sleep and not having to know anything until I woke up knowing that I had new teeth. To be able to look at somebody and smile with confidence, it's worth its weight in gold. I can't even tell you what it's like. I mean, it's worth $1 million to me. When you think about how much money you put in your mouth, when you have this done, you'll never have to go to the dentist ever again. Think about the value in that. I tell people all the time about New Teeth Now, about the positive aspect it has put on my life. If anybody's on the fence to go to New Teeth Now, run, don't walk. It has been a lifesaver for me. It's been a life changer for me. It gives you so much confidence. I can't even put into words how happy I am that I went to New Teeth Now.
So you can really just tell with her energy how much life has gotten better since the procedure. Definitely. Let's see. My slide. Okay, so here's a good before and after. My slide wasn't advancing fast enough. Okay, so let's talk a little bit about the CT scan and what we're looking at. So we're going to kind of compare traditional implants to zygomatic implants, and I'll have Dr. Richards kind of talk about that.
Okay. So this would be a typical type of procedure where the sinus doesn't come too far forward, but it does drop low in the back. And we use tilted implants in the upper. The upper is what's on top. And the implant that is to the far right position and to the far left position is tilted right up along the front of the sinus. And then the other implants are kind of spaced out evenly around for a total of 6 up there. And you can see 5 on the bottom. Also on the bottom, the far right and the far left implants are tilted as well. And that is because there is a nerve that runs through the lower jaw, and it comes up to a little hole right about the corner of the mouth. That hole is where the jaw nerve comes out and fans out into the tissue, supplying feeling to the lower lip and chin. And so we want to get the working part of the implant as far into the rear as possible. The body of the implant can be more to the anterior, and then we have what's called an angled abutment to straighten that so that they can be as parallel as possible. And you can see that there's the use of angled abutments on all of the tilted implants. Very common technique. Just the same variation in the lower. You're actually able to see the little dark hole on our left as observers of this slide. To the left of that tilted implant is a little dark hole, and that's the nerve, so it's tilted out in front of that nerve. But you can also see the nerve is a little deeper, so some additional implants were placed more to the rear in the lower jaw for a total of 6. And that's a nice technique to use short implants as a supplement to traditional length implants. Then in the upper jaw, same type of a setup in the front of the upper jaw, but because the sinus came more to the front. Okay, in that other slide, the sinus was more to the rear, which allowed room for a tilted implant. But in this particular situation, the sinus came more to the front, which did not allow a tilted implant. It would not allow 6 traditional implants, so those are zygoma implants. It's just a different way to skin the cat, so to speak. And those are just single zygoma implants, 1 on each side. This is also very common. And this is the so-called quad zygoma technique, where there's no bone in the front, no bone in the back. The sinus may come well to the anterior or it may not, but a lot of these types of jaws are very flat, and there's no other option other than the quad zygoma technique. So, the benefit is no bone grafting, and you can load them up the same day.
Yes.
So they can get their teeth the same day. No bone grafting.
Yes.
And that's a big deal. Bone grafting is just something to cause a problem, get infected, takes time to heal, costs more. Zygoma implants don't require bone grafts, and you can load them right away. So there's 2 of the great advantages of zygoma implants. Plus, they're very strong.
So if you've been told you can't have implants because of bone loss, your solution would be zygomatic implants. So
right.
Definitely come and see
Right.
us, have a consultation, and we'll go through all of the options that you would have for that. And this is Dr. Richard's team. This team of ladies you will get to know very well if you're a patient of his, because you'll see them not only on surgery day, but for all of the post-operative appointments.
Right.
And they're a great group of ladies.
They are.
They are. And then we have our restorative team, Dr. Nofala and Dr. Dibbs. And we're going to have Dr. Dibbs kind of explain how the lab functions and works with, how his team functions with the lab and how they, collaborate together.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have. We really have to spend the time with the patient, that you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists, and they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
So there is that great collaboration in making
Yep.
smiles every day for our patients. We did have a couple questions come in, so these are great. Please talk about maintenance after surgery. So what does it look like?
Well, included with our deal is 2 years of maintenance. And what maintenance looks like is to have the teeth unscrewed, removed from your mouth, put in the ultrasonic cleaner. While that's going on, we go into your mouth, and the pieces in the mouth, which I probably should digress and kind of talk about that a little bit, but when the teeth come out, what we see are what's called abutments. And they are sticking up through into the mouth, visible clearly. The tissue does not cover them. And the abutments, screw into the implants. And so while the teeth are out being cleaned, we check the screws and make sure that the screws holding the abutments into the implants are tight. Sometimes some tartar, or what we call tartar or calculus, particularly in the front, can attach itself to the abutments, and we may actually remove the abutments to clean them. Once the teeth are clean and the abutments have been checked and are clean and tight, then we put the teeth back in. So it's not like sitting with a hygienist picking around on your teeth. This is a whole different concept of teeth cleaning. There are holes where the driver inserts through the teeth to tighten the screws. The screws go into the abutments and hold the teeth to the abutments. And those little channels, which are very small, are filled with a rubber cement, or they can be easily removed later. Now, there are some situations where the rubber cement just doesn't stay in, it wants to come out. And in that case, we can put some light cured filling material, which also is easily removed at a later date. So we include 2 years of maintenance visits. We like to see, and we would mean Dr. Dibbs and Dr. Nofala. Typically it would not be me, although I do that. And the ladies that work for me are more than capable of doing that, and it does not have to be a hygienist, because like I said, we're not scraping around on your teeth. So after the 2 years, then we like to see you once a year. Now, we see people from all over the place, and people ask us all the time, could I go to another dentist in my area and have my teeth cleaned? And the answer, of course, is yes, you could. And if you're going to do that, we'd like to talk to that person to get some idea of their level of experience and make sure they have the appropriate little screwdrivers and things of that nature. But that's kind of what it looks like.
And we also provide a Sonicare toothbrush and a water flosser. So after surgery, you're going to brush twice a day, water floss once, twice a day, however much you need, and that's daily maintenance as well. So it's it's similar to taking care of natural teeth, just different in small ways. Yeah.
And so we're sort of contradicting the lady in the first video who said you never have to go to the dentist again.
Yeah, you still have to go to the dentist.
That's not true.
Just not for tooth problems.
You could follow that and never go to the dentist again. And what would happen is at some point, something may get loose and you may end up back with us again, not on your terms, but on the terms of your teeth. So it's a good idea to keep up good regular maintenance.
Yeah, definitely. Good question. Do you ever run into an issue where there isn't enough bone on the bottom arch? What's the solution for that?
Well, occasionally we do see really tiny lower jaws, and they may be tiny in width, front to back width, or recently we have seen some jaws that were very tall but very thin. And the very tall, very thin jaws typically may be taken care of with more narrow diameter implants, like 3.0 millimeter implants, even if we have to do a little grafting around those implants at the same time that the implants are inserted. Now, the jaws that are really narrow in a width dimension, that can be a problem for these screw type implants and may have to resort to a different type of implant called a subperiosteal implant. And this is an implant that's custom designed to fit that jaw sort of like a saddle, and it doesn't go into holes which are drilled into the jaw. So when you get down to where the lower jaw is really tiny, there are some other options. I guess namely the subperiosteal implant would be the ultimate option for the tiny jaw.
Perfect. Is there a thread locker approach applied to the screws?
A thread locker, no. No, we don't use any thread locker. There's no like medical grade thread locker that I know of. But we don't. We apply torque to the screws with a torque wrench, but not thread locker.
I've never heard that question. That's good. All right, so let's kind of talk about what it would look like to come in for a consultation. So you would meet with one of our implant coordinators, Shauna, Allie, and Crystal. Crystal is in the Villages, and then Shauna and Allie are in Lakeland, and we have a new coordinator in Lakeland, and we just got to take a picture of her and add her here. But these ladies are awesome, so whoever you come in and meet, they will walk through the whole process. So on the day of the consultation, you'll first take a CT scan, and then there will be Dr. Richards will develop a treatment plan with exact fees, so you would know exactly what the plan would be if you had surgery, and then of course you can talk with them about the process, any questions, everything pertaining to your specific case. And we will finalize the treatment plan at that time as well. And Dr. Richards will go through and show you like where he'd place the implants and your bone lot, like all those things are explained in great detail. And for the New Teeth Now process, so here is another brief overview from start to finish. So, we just talked about the consultation. Say you want to move forward and have surgery. The next appointment you come in for is before surgery. It's our pre-op and impressions appointment. And then you'll have the day of surgery. Then you'll have a series of post-operative appointments while everything is healing. And then once the implants have fused to the bone, we will start creating the final teeth and then place the finals, and maintenance is after that. So the maintenance we talked about, that's for the rest of your life to maintain your healthy smile. Do you want to touch on anything here?
I do. I want
Okay.
to back up a little bit, and I want
Yes.
to talk about two things. I want to talk about what abutments are, and I want to talk about the management of the teeth. So let's first talk about what abutments are. So there are three components to this system. There is the implant, which is a titanium bone screw that goes into the jawbone. Then there is an abutment, and the abutment screws into the implant. Abutments come straight, 17, and 30-degree angled. And for the zygomatic implants, there are some 45s, 52s, and 60-degree abutments. So the abutment allows us to manipulate where the screw hole is going to come through the teeth. So we do not have to have the screw hole coming through the front of your front teeth. So abutments are what the teeth screw to. The abutment screws into the implant. So you have the implant, the abutment, and the teeth. The implant is countersunk slightly in the bone. The abutment sticks up through the tissue. So I hope that clears that up about the abutment. Now, the management of the teeth. We do something unique in this business with the management of the teeth. And we talked about printed teeth at the very beginning. So printed teeth are what goes into a person's mouth on the day of the procedure. The printed teeth take 3.5 hours after Roxy gets the files emailed to her, and then she emails the files to Terry, who prints the teeth, and that takes another 45 minutes to print them, cut off the sprues, put some color on the teeth. The teeth then go into the mouth. So we see that person about 2 weeks after the procedure. And we get out in front of that person and we look, and we're looking at the midline first. Want to see if the midline is in the middle of their face. Did we get the midline in the middle of their face at the time of the procedure? What's the relationship vertically? Are their upper front teeth way up under their lip? Are their upper front teeth down a little too far? Are their upper front teeth just about right at the lip line? How about the lower front teeth? Are they down too far? If they are, you might bite your lip. Are the lower front teeth up too far where you see too many of the lower front teeth? Are they just about right? So we look at those. In addition, the person has had a chance to look at the teeth themselves, the size, the shape, the color. They may have some changes that they want to make with that. I may have changes that I want to make with the midline, the lip line, and all that. I write a prescription to Roxy, the designer. She has the files for the printed teeth in your folder in her exocad software. She takes the changes and she has a fixed reference point from which to make those changes. So she makes the changes and we mill out the zirconia. You come back in 2 weeks, we unscrew the printed teeth, we put the zirconia teeth in your mouth, screw them in, and adjust the bite. And that's what you wear during the healing. And that is the so-called post-op zirconia, temporary zirconia, whatever, first set of zirconia, whatever you want to call it. So you wear a set of teeth during the healing that's zirconia, the material that the final teeth are made of. We don't want to call them the final teeth yet because we need the tissue inside of your mouth to fully heal. There may be gaps that open between the teeth and the gums, and so we want all of that healing to take place for 5 months. Then we make the final teeth. We analyze midline, lip line, is there any canting? We look at all of those parameters. Typically that's Dibs and Nafala doing that. They look at all of those parameters. Person's been test driving these teeth now, 5 months. They might say, I'd like to have my front teeth just a little bit wider, a little bit whiter, a little bit darker, a little bit something. You know, I want to make them look more natural. Maybe rotate that tooth just a little bit so they don't look so perfect. So then we make the final zirconia teeth. at the end. So, to summarize, there are 3 sets of teeth. There could be 4, depending at the beginning how good we do. But the printed teeth go in on the day of the procedure. At about 1 month from the date of the procedure, we put you into your first set of zirconia teeth, which you wear during the healing, and then at the end, you get your second set of zirconia teeth. We do it this way. We feel like our client gets the best result this way, and you don't have to worry about breakage and teeth popping out of the plastic, and I could bore you all night with all that. All the problems, you know, with having plastic temporaries when they live in Minnesota and they call us and 2 teeth have popped out.
We don't have to deal
We
with that
don't want to
anymore.
deal with that anymore.
Yeah.
So we started doing zirconia for the out-of-state people, and we just blended it right in to now we do zirconia for everybody. Works really well.
An amazing
And,
benefit
yeah.
for the temporaries,
So
definitely.
that's kind of where we are. I'm sorry that took so long. I was a little wordy with all that.
It's good
But
explanations.
we're unique in the management of the teeth in that regard. I would also like to say that when we're talking about this, this is full arch work. The upper jaw, the arch, full arch, lower jaw, arch. You all should all know that we are the largest single office full arch center in the United States. There might be other businesses that have multiple offices, and a combined, the combined work of, let's say, 3 or 4 offices may approach what we do, but we are, without question, the largest full arch center in the United States. So if you come to see us, you will know that you're coming to people that do this every day. And if you're going to go have your heart done, you go to somebody that's doing it every day. If you're going to have a knee replacement, you go to somebody that's doing it every day. And if you want to have this done, you come to somebody that's doing it every day. And that's what we are.
Yes. We did have a few questions come in. Do you do Invisalign? That we can
I
explain.
do not do any general dentistry, don't work on teeth at all. Only thing I do to teeth is remove them.
Yes, so full mouth dental implants
Right.
only.
I do full arch work only. Occasionally, because I've been in Lakeland so long, I'll have someone who I removed their wisdom teeth 40 years ago want me to remove the wisdom teeth on their granddaughter, and I will do that. But typically, I'm full arch work only.
Yes. Let's see. When can you start chewing after the procedure?
Soft diet the next day. That would be like fish, anything soft,
Kind of
homemade
mushier
hamburger
to
patty,
chew.
that type of thing, anything soft.
Let's see. For the base price, I'm going to talk all about pricing in just a couple of slides, so hang tight for that. We'll talk about all those options and financing options. I have an overbite. Will the bite still line up for chewing?
You know, that's kind of interesting. An overbite meaning the upper teeth are here and the lower teeth are back here, if that's the kind of overbite you're talking about. What I have found over the years, if you take someone who's got this kind of overbite, they will, whether they realize it or not, kind of position their jaw forward so that their front teeth contact. And it's interesting that if during the procedure we set them up kind of normal, afterwards they're like pushing their jaw out. And so typically with an overbite, I will correct it a little bit and start out there. And that's a situation where we might make 2 or 3 sets of teeth, fiddling with the overbite amount and what feels good to that person, where they feel comfortable, because that's just the way that works. Mm-hmm. We're not talking about, where the lower jaw is like, well, that's not the kind of overbite I'm talking about. I'm talking about where the lower jaw is back. Mm-hmm. Or not only is it back, but the person is biting way up against their palate.
Gotcha.
So we see a lot of that.
Sounds like you make sure they have the perfect smile when it's all said and done.
We like to do that.
It's all based on their preference, and we
Yeah,
try
beauty's
to.
in the eye of the beholder. Some people like white teeth. We have like Hollywood white stains for the zirconia. Some old 70, 80-year-old people, man, they want their teeth so white. But it's, beauty is, seriously, it's in the eye of the beholder. And my feeling is, I don't try to push my values on anyone about the way their teeth look. If somebody wants something, I give it to them. If they want this or that, or, yellow teeth or whatever kind of teeth, or if they want them a little too big or something twisted or turned. Because in the final analysis, we're trying to make you happy, not me. And I think a lot of dentists kind of force their, preferences.
Their own opinion, yeah,
Force their
preferences.
preferences
That's a good idea.
on people. And I think you'll find that, when talking with Dibs and Nafala, I know I feel that way, I'm sure Dave does, that, you gotta work with the person. And most people want something that just looks good, and also choose.
Or feels like them, or choose
and that it
good.
chews well too. I mean, these zirconia teeth. I mean, you can eat anything with them. You're not going to break them. That's for darn sure. But getting you a nice smile, I would say that if you polled, 100 people that came for a consult, and you ask them why they were there, their number one reason, it would be that.
Yeah, to have a nice smile.
Have a
again.
nice smile. Yep.
Really great questions. We have a couple more. What if you have an infection in your gums and 8 teeth that need to be pulled out and teeth that need to be replaced? It's kind of what we talked about before.
Yeah, we do a lot of this work on people who have advanced periodontal disease. Not a problem.
Yes. And can you do one set at a time due to finances?
Yes.
We can. And I will talk about the breakdown of pricing for that as well. And then last question, how do you change the color of the teeth?
Well, there's stains. In the zirconia teeth, you probably didn't pick up on the one slide, it was real brief, about milling out the zirconia frame. The gum is pink porcelain that's baked onto the zirconia. The teeth are stained. So it's pretty easy
it's like paint,
to...
the color's painted different.
The printed teeth are painted kind of like a nail technician. They have some stains and some paints that are compatible with the printed material, and they literally paint the teeth and the gums.
Yes, really good questions, and you can keep submitting them. We're gonna watch a video of so this is Tammy. She had always had dental problems and really just stopped enjoying life and felt like she became a different person. So we're gonna hear from her and how her life has changed since New Teeth Now.
The thing that I heard afterwards is, aren't you glad you did it? And why did you take so long to do it, Tammy? And they're right. I don't know why it took so long, but I'm glad I did it. Hi, my name's Tammy, and I am not an actor. I'm a real patient at New Teeth Now. From a young age, a lot of issues with my teeth. I've had multiple root canals. I believe every one of my teeth had a crown or a cap. It affected me as a person. I quit smiling, I quit laughing. Things that I loved doing prior, I no longer had done. I wasn't the Tammy that everyone had come to know. My dentist that I had tried to save my teeth. It was a constant battle. I've spent thousands and thousands of dollars on trying to replace and keep them, and I just felt like my dentist wasn't listening to me. So I decided that I had to do something for me and make a change. And my daughter-in-law, actually, she suggested that I try New Teeth Now, and it was the best thing I ever did. In my consultation, they did a CT scan, and they found that I had infection in my gums, that had gotten so bad that the teeth had died. I had no feeling. And I think that if that wasn't found then, that maybe I wouldn't be sitting here today. I'm sorry, hang on a second. I do not think my regular dentist would have caught that. I think that they were worried about putting a Band-Aid on it. I would have gotten severely sick. I know that New Teeth Now has saved my life. I felt like the doctors at New Teeth Now, they knew what they were doing. They knew what to look for. That meant more to me than any decision that I would make. And I did look at other places, but kept getting pulled to New Teeth Now. And I'm so glad I made that choice. New Teeth Now changed my life in one day. The surgery was great. I didn't have the pain. I left with a full set of teeth, and I had no issues whatsoever. To be able to eat what you want to eat, chew on what you want to chew, it is phenomenal. I'm happy to be around people. I'm not embarrassed. I don't put my hand over my mouth when I talk anymore. I love to smile. I love to laugh, and it's brought me back, and I'm so thankful for that. I've become proud again. I'm happy. I've lost over 40 pounds now. How's my confidence? It's out of this world. I feel so good. I'm so happy. I'm doing things for me that I put off for so long because of my confidence not being there because of how bad my teeth were. The world is my oyster, and I feel great. That's not me. That smile that you see is fake. The smile that you see today, this is real and more genuine than this ever would be. But I'm happy today because of New Teeth Now. And just do it. Don't wait. Don't wait like I did. You deserve it.
And you can just tell from her emotion, like really how much her life has changed.
Yes.
It's amazing to see.
Yes.
All right, and
Yeah, it's really amazing how something that I go to work and do every day, I don't think that much about it, really has such a profound impact on some people.
Yes,
They
it's
break down
amazing.
and cry.
It's amazing.
And
yeah.
it's really it really is humbling, really.
Mm-hmm. Before we go into the key differentiators, let me look at the questions. Okay, so any thing about the cost I'm going to talk about in just a couple of minutes. That's great. And that's good. So she's just talking about function is her main goal with the teeth, and that is ours as well, for sure.
But if function is your main goal, the aesthetics is going to be the side effect of that. So
you kind of get both.
You'll get both.
Yeah. Can you look at our older photos before dental issues to help us get back our true smiles?
Yes, and I think Dr. Dibbs can do that. However, there are some, when folks come in, they're 65 and 70, and they show us a picture when they were 22. We can't turn back the clock that far, but it does help in terms of lip line and all that. But then you have to temper that with, as we get older, our faces droop. And so, everything's different. So there has to be some reasonable expectation. But I think pictures are helpful.
Yes, they are. Do the teeth stain over time with tea or coffee?
The zirconia, which is glazed over the color, and the baked on porcelain over the zirconia framework, it's glazed with a clear glaze, and it does not stain that much, and the stain can be removed. It will remove. Now the printed teeth, they will stain for sure, but the zirconia is, and you used to have a picture in here of some 5-year-old zirconia teeth.
Yeah, with the zirconia versus acrylic.
Yeah, but the zirconia, glazed zirconia, really is
Here's the image.
Now,
Yeah,
these were
so
5-year-old teeth.
You can tell the difference here. So the top set is a zirconia set of teeth, and the bottom set is an acrylic set, which we don't place acrylic at all, but some practices still do. And these both have been worn for 5 years. So you can see right here how the zirconia still look brand new, and that's because when we take them out and polish them, it just takes any stain away, versus the acrylic kind of absorbs that stain and odor, and it just doesn't look, it needs to be replaced, you know?
And let me make a comment about this, because this is something else that we hear and folks ask and comment about. And if you look at that set of zirconia teeth, you can see that there's some artificial pink gum tissue. Now that is pink porcelain that is baked onto the zirconia. And so when these are milled, the computer knows when you pick a size for the front teeth, the computer knows what the golden proportion is for the front 6 teeth, because the upper front 6 teeth set the tone for the entire setup of all of the teeth. So the upper front 6 teeth have to fit over the lower front 6 teeth, and then the rear teeth sort of fall into place, and there's what's called a curve of Spee and a curve of Wilson, and the technicians, I got to quit saying that. Roxy will set the teeth up digitally in exocad. It used to be the technicians that set the teeth up, but now in the digital world, that's all done. The computer knows there's this curve and that curve, and the computer knows the golden proportions of the teeth and all that. The point I was going to make is that the teeth have to be typically in about a 8 to 10, if it's 10 millimeters tall, it's going to be about 8 millimeters wide. So there's that 80% ratio. And so if we're going to move the teeth down below, to get the teeth down below the lip a little bit, we're not making the teeth longer. We're going to increase that zone of pink gum tissue. And so the teeth have to be normal length to width, so when you smile, they look normal. You can't smile and have big old long teeth.
Yes.
And so the artificial gum fills in between where the teeth are and where the person's natural gum tissue is. And this is something that we see more on people who have been in dentures for a long time. They've lost a lot of bone, therefore the tissue has gone away with the bone, and so there will be more pink artificial. And if a person has lost less, then there will be less pink artificial.
Yes, and it looks totally normal when you smile. It's matched to your natural gum, so it's very, very natural, very natural. All right, so let me go to the key differentiators. So these 3 things kind of set us apart from other offices. So we have all board certified oral surgeons. We offer zygomatic implants and place them on a daily, weekly basis. And then we offer general anesthesia. Is there anything you want to hit on here?
Well, you know, a lot of people may not know what an oral surgeon is from a regular dentist. So after I finished dental school, 4 years of dental school, 4 years of college, 4 years of dental school, I went down to Jacksonville. I was accepted into a 1-year general anesthesia fellowship. So I went to Jacksonville, Florida, Shands Hospital, and spent 1 year in the operating room putting people to sleep for everything. Of course, under the watchful eye of an anesthesiologist at first. Then I did another 3 years doing an oral surgery residency. And so all of us, Dr. Kay, Dr. Kirkpatrick, Dr. Vorwald, Dr. Rentel, Dr. Nunez, all of us who are oral surgeons did dental school plus 4, 5, or 6 years. Dr. Vorwald did 6 years, and she is a dentist and an MD physician. So she was formerly, before joining us, she worked at Moffitt Cancer Center doing head and neck cancer surgery. So then that's the reason we can do general anesthesia in our office, because we're trained in general anesthesia and we can supervise certified registered nurse anesthetist. So general anesthesia is administered by CRNAs, certified registered nurse anesthetist, and because we have anesthesia training and we are licensed by the state of Florida to administer general anesthesia, we can supervise the nurse anesthetist. So that allows us to do general anesthesia in the office. And then, you know, the zygomatic implants are typically, I mean, that's our playground, you know. I mean, you know, there are some general dentists who have branched out into that area, but not very many.
Yeah, so these are all great things to consider. And I will go into resources and then pricing. So for additional resources, you can follow us on Facebook, on Instagram, on YouTube, which you're here now, and on TikTok. You can see more before and afters, more videos. You can always message us with any questions on those apps. And then you can also join the New Teeth Now community, which is a Facebook group. You can search that in the Facebook search bar and talk to other patients who have been through the procedure. You can post in there and ask questions, and everyone's super helpful and super nice. So if you want to learn more or hear from someone who is going through the process, definitely head there. So I encourage you to give us a call, message us with any questions. You can also message us on our website. And we do have Lisa on the phones tonight for about another hour. So if you'd like to go ahead and set up that consultation, she is on the phone. You can just give her a call at the number below, 1-800-615-5838. She'd be happy to schedule that for you. But we thank everyone for joining us. Yep. We had a great time answering really awesome questions, so thanks for submitting those.
We have email as well.
Yes,
she has email.
Any way that you want to reach us, please reach us. We're happy to talk with you and answer your questions. But yeah, thanks for joining us, and we hope everyone has a wonderful evening.
All right. Good night, folks.